there's not a physician in this country, practitioner, prescriber, who's not involved in some way in value-based care. That individual's salary, compensation, livelihood is directly tied to some measure of value, whether it's a quality reporting for Medicare. If you participate in the Medicare program, you're by definition participating in a pay-for-performance value-based payment form. If you're an employed physician, which most are these days and more becoming, you're largely going to be part of an integrated delivery network, an accountable care organization, some way that there's risk that they're taking for the populations that they're serving. And so for life sciences, sales reps and professionals interacting with the prescribers and the physicians, to best position you for success in communicating and engaging those physicians, you have to understand that larger context and know what it is that those programs are, whether it's a hospital-based system for readmission reduction penalties or the quality reporting system, MIPs, for physicians. The more you understand that, the more you can help to make the case in a sense, and also just communicate effectively what the values that the medicine, the device, the innovation brings to them and to their healthcare system and practice.
Yeah, and that's an important point, because as somebody who's part of an ACO, working with medical device and medical pharmaceutical representatives, over the course of many years, there's been a big transition to the value-based care system, such that at one point in time, somebody would come up to you and say, we have this great new device, or we have this great new medication, and we'd like you to try it with your patients, and we have a lot of clinical data to support its use. And as a physician, you would be able to say, sure, let me review your data. Let's talk about this. And if we thought that this was going to be helpful, and we would partner and we'd work together, and we'd bring it into the clinics and use it. Now it doesn't work that way. You can have a tremendously successful product that shows absolute clinical benefit for patients that's very expensive, and the hospital administration and a pharmacy and therapeutics committee will say, you know what, we are not ready yet to make these decisions, and in our hospital network, we're not there. And so it's extremely important to be able to navigate those obstacles and be able to show benefit and profitability in a value-based care system, such that patients are going to benefit, caregivers are going to benefit, and everybody works together as a partnership.
I think of that in the framework that practitioners, again, physicians, nurse practitioners, whoever they are working in healthcare now, they're busier than they've ever been, right? They're seeing more patients for less time than they ever have been in the past. And at the same time, again, we've seen that transformation of how they're getting paid, how they're getting reimbursed, how drugs and other therapeutics end up on a formulary, off a formulary. It's such a challenge, I think, for the practitioner at their level to keep up with that on a daily basis. And I think that one thing that this allows them to do is to hear it from a neutral outside source that's reliable, that can come in and teach them what those nuances are. And again, it's not a static process, right? Today, maybe it's value-based. Who knows, maybe tomorrow it goes back to something that it was in the past, or maybe something different in the future. And I think that the ability to educate those folks is really helpful.
Now, first, I'd just like to thank the panel for their responses that were very thoughtful. I think the answer is quite clear. There was a day in pharma that we all remembered where you could kind of train the disease, the product, and the selling skills that surrounded the brand and that disease state, but there's so much more that you were all able to effectively articulate. Now, what that will mean over the long term is this type of training would be part of your brand strategy overall, and it would be very specific to your ecosystem and your environment. I appreciate your commentaries.